person. So the clinical manifestations, the incubation period is almost always between 13 and 14 days between exposure and the onset of the rash. And we were always taught a cough, the 3 C's, a cough, coryza, and conjunctivitis. If you see those 3 in combination, think measles, along with fever. And the important thing is this prodrome begins several days before the onset of the rash. And these people are highly contagious at this point. So if you wait until you see a rash, this person has already been contagious for at least several days. And all those people who that patient has been around may have been infected as well. Okay. Henry Koblik was a pediatrician in the 19th century who described these spots, and they are ulcerated mucosal lesions that are marked by necrosis, a neutrophilic exudate, and neovascularization. They've been described as grains of salt on a wet background, and again, they appear before the rash. Once you've scraped them and determined that it's not thrush, which is probably the most important differentiation, they don't scrape off. And so these are considered pathognomonic of measles. So if you look, so they're just lateral to the 3rd and 4th molars. You have to look hard for them sometimes, but if the patient has measles, then you're going to find them. And if that happens, then that patient needs to be considered to have measles, need to be considered to be contagious, and they better get out of your waiting room. And that's a lot of outbreaks have happened as a result of kids coming into doctors' offices and sitting in the pediatric waiting room, shedding virus with Koblik spots before they recognize as what they have. The rash is erythematous, maculopapular, and starts usually on the face and behind the ears, then spreads to the trunk and the extremities, and really represents the immune response to the rash. And if you get a rash like this, it's usually when you're about to start getting better. And the rash, once that happens, then you're considered contagious. Your contagiousness starts to drop off. Thank you, Claude. And 4 or 5 days after the onset of the rash, then you're probably no longer contagious. So the shedding of virus from all mucosal surfaces, especially the respiratory tract, but also the gastrointestinal and genital tracts, all shed this virus, again, because it's a systemic disease. Profound immune suppression happens as the result of infection of these T cells. Both T4 and T8 helpers and the cytotoxic T cells are suppressed during this illness. And measles mortality actually results from the profound immune suppression that happens, and that immune suppression can last for weeks or months. And actually, you don't usually die from measles. You usually die as a result of secondary infection, either the respiratory tracts or the gastrointestinal tracts. We also now know that Nectin-4, that marker on the respiratory epithelial cells, also was found on postsynaptic neurons. And so we think that's probably why some people get encephalitis, because there's a direct marker there that actually binds and takes in the measles virus right up into neurons. So again, it's a horrible disease, and this is a great quote. Paul Offit is an infectious disease physician at Children's Hospital in Philadelphia, and he found this quote: "That fatal and never to be forgotten year, 1759, when the Lord sent the destroying angel to pass through this place and removed many of our friends into eternity in a short space of time, and not a house exempt, not a family spared from the calamity. So dreadful was it that it made every ear tingle and every heart bleed, at which time I and my family were exercised. But with that dreadful disorder, the measles, but by blessed God our lives were spared." So somewhere along the line, the idea that measles was a benign disease sort of got into our thinking, but it's never been the case. And fortunately, the mortality is relatively low, but it can be very significant, especially in the immunocompromised individual. So again, I mentioned there would be between 5 and 8 million deaths annually from this disease worldwide before the vaccine. In the United States, there were 4,000 cases of encephalitis and 450 deaths per year. So between 0.2 and 0.3% of all cases of measles ended up as a fatal case. And the death is either from primary pneumonia, so-called hex pneumonia, or, as I mentioned, secondary bacterial pneumonia caused by Staph aureus, the pneumococcus, and the encapsulated strains of H. flu. A lot of bacterial otitis media, severe gastroenteritis, and then a keratoconjunctivitis that can sometimes cause blindness, especially people with vitamin A deficient. Pardon me. So between 7 and 9% of kids with measles get otitis media. 60% of deaths from measles are from pneumonia. Diarrhea in about 8%. Encephalitis, I mentioned. Subacute sclerosing encephalitis, which is they just fail to clear the virus from the central nervous system and have a subacute development over the course of several years, invariably considered a fatal disease. Mortality in developed countries, as I mentioned, was 0.2 to 3%, but in developing countries, significantly higher. And if you have an HIV-positive child who's not receiving antiretroviral therapy, the mortality from measles is 50%.
George?
Yes?
Is the otitis media a secondary bacterial one, or?
Yes. Yeah, the question was, is the otitis media secondary to bacterial infection? So that's correct. All right. So how contagious is measles? So in general, we look at the contagiousness of virus by looking at what's called the basic reproductive number. And this is the average number of other individuals that one person with a certain disease is going to infect if that population of individuals is not immune to the virus. And so in relative terms, you can see that influenza A, rubella, and then measles are the representative ones who are here. And it's a relative, it's just a way of comparing the contagiousness of different diseases. But you can see that for measles, the R0, the basic reproductive number, is somewhere between 10, 15, up to 18 or so. And therefore, measles is considered to be among the most contagious of all infectious diseases, with an R0 of somewhere around 15 to 18. Is that clear? So if you have somebody coming into a completely unimmunized population, on average, they're going to infect 15 other people. Influenza, on the average, is about 4 or so. During the height of the Ebola outbreak, when people were dying, and as their virus level got the highest towards their mortality, even then the R0 was about 2 or so. So measles is far and away the most contagious of those. And the only other things that come close would be pertussis, probably, as well as varicella or chickenpox. So let's talk a little bit about herd immunity. And that term is one that came out from an article from way back in the 1920s. The spread of bacterial infection and the problem of herd immunity was the name of the article. Herd protection would actually be a more accurate term. And basically, it's resistance of a group to attack by disease due to immunity of a large proportion of the members. So if a large population is immune for whatever reason, then if somebody comes into that community with a new disease, then it's much less likely to spread as the result of people already being protected either by vaccine or by recovering from a previous illness. And this lessens the likelihood of an infected individual coming into contact with a susceptible individual. And the concerns we have here are the HIV-positive people, the kids with leukemia, anybody who can't take a live vaccine, as well as people who are just too young, because we don't start immunizing against measles until after your first year. And so it makes sense then that the more contagious a disease is, the larger number of people who have to be immunized for herd immunity to be present. And the formula for that is 1 minus 1 over R0. So if R0 is 18 or 15, in that situation, it would be 1 minus 1 over 15, or about 94%. So 94% of individuals need to be immune in order to provide a significant amount of herd immunity against measles. Whereas for other diseases, a little bit lower. Even for smallpox, the R0 is about 5 or 7, so only 80 to 85% would need to be protected in order to provide herd immunity. Does that make sense? That's a very important concept, and that's why it's so important to immunize as many people as possible in order to generate that kind of herd immunity that protects the general population as well as those who are most susceptible. So what about vaccines then? Well, Enders and Peoples set out to cultivate the virus in 1954. And then Edmondson was a boy at the Fay School outside of Boston, and he developed measles during an outbreak. And so the virus was isolated from him, from his blood, inoculated on the kidney cells. And so the Edmonton strain comes from the name of the boy who actually had measles back in 1954. So Enders and Peoples then did serial passage, and that's a common way of weakening or attenuating the viruses by passing it through several cell lines, and the virus goes through serious mutations, making it less and less virulent, but still able to generate an immune response. And so the Edmonton strain vaccine was first licensed in 1963 as a live virus vaccine. Now, Maurice Hilleman is probably the greatest scientist never to have won a Nobel Prize. He actually is from Miles City, Montana, and he graduated from Montana State University. Excuse me. And he alone is credited with developing more than 40 different vaccines. Maurice Hilleman developed more vaccines than any other person in history. And is primarily the chief scientist at Merck. And he looked at the Edmonton strain of measles and decided that he was going to try and develop a more attenuated strain. So the more attenuated strain stands for more attenuated Edmonton strain. And that is now the vaccine that's used exclusively in the United States today. So the more attenuated strain is thanks to Dr. Hilleman from Miles City, Montana. Fever happens, rash happens, febrile seizures. Severe allergic reactions are quite unusual. And so these are recognized, and this does not necessarily mean that the patient's going to have sequelae. And actually, if you get measles, the risk of a febrile seizure is significantly higher. So even though that is not desirable, the risk if you get measles itself is much, much higher than that. And so it's still the better thing to do. And so you can see what happened when the vaccine was introduced in 1963. And then in 1989, a second dose was recommended. And you can see the incidence of measles in the United States just dropped off precipitously. We think that the measles vaccine is probably about 97% protective if people receive 2 doses. One dose provides probably about 92, 93%, and so that second vaccine dose sort of kicks it up into that upper percent range. So when we start looking at various infectious diseases, the concept of global elimination is one that becomes very, very desirable. And smallpox right now is the only human disease that has been eradicated, and this was on the result on the basis of a mass immunization campaign that was done globally. But Rinderpest, remember that's the grandfather of measles. Actually, it was one of the 10 plagues of Egypt, and a vaccine was developed against that as well. And the last confirmed case of Rinderpest was in 2001. So Rinderpest is the second disease of mammals, if you will, to be eliminated from the globe. There's no more Rinderpest either. And so what about human diseases? And the Task Force for Disease Eradication identified several different diseases that were potentially eradicable from the globe, to include guinea worm, and the Carter Foundation has been instrumental in getting guinea worm under control. And really, Sudan, Nigeria, a few other places, especially ones that are suffering significant economic upheavals, etc., are the only places left in the world where guinea worms is found. Polio, and that's a whole different story. We were close to eliminating polio. We've had some resurgences. We still think that polio is on the way out. Measles, mumps, rubella, lymphatic filariasis, and then cysticercosis. These are all the ones that have been identified as potentially eradicated from the globe, and the consequences to human health will just be enormous if we got rid of all of them. Now, it's important to look at the terminology because elimination and eradication are very different. Elimination is cessation of transmission of a disease in a single country, continent, or other limited geographic area. And that's what we're talking about in the United States and the Western Hemisphere, versus eradication, where reduction in the worldwide incidence of a disease to zero as a result of deliberate efforts. And so rinderpest is eradicated, smallpox is eradicated. Control means reduced incidence or prevalence of a disease or condition. The problem is that eradication and elimination are closely related terms, and they may not have distinct equivalents in a lot of different languages besides English. And so that's important when you read some of the international literature. But for American and English purposes, elimination and eradication are two different terms that are related but not the same. So what we did was we eliminated measles in the United States and in the Western Hemisphere. That was the first step towards global elimination, and we were very, very excited about this because of the use of the measles vaccine, especially the Moritans strain developed by Maurice Hilleman. Then along comes another name that will live in infamy, Andrew Wakefield. And if you try and look up this article in the Lancet from 1998, you'll see this big retracted on it. This article has been roundly condemned. Every author on this paper has withdrawn their support of the paper. Andrew Wakefield, unfortunately, came out with this theory that the measles vaccine is associated with autism and with other systemic diseases. And then, unfortunately, that fed into other anti-vaccine ideas, et cetera, such that Jim Carrey, Jenny McCarthy, and a significant number of people in Hollywood take on the MMR as bad. As a result, MMR vaccination rates plummet in the United Kingdom, Europe, and the United States. And in Europe and the UK, those rates have never really recovered, despite how roundly this has been completely eliminated as a consideration. The Lancet paper described 12 children. It turns out that the records of all of those cases have been altered or misrepresented. He was accused of research fraud, of unethical treatment of children. He had lawsuits against various MMR manufacturers, and he actually had patent filed for a safer measles vaccine in products for diagnosis and treatment of both autism and inflammatory bowel disease, which is one of the diseases that he linked to the vaccine. And so there's a series of articles in the BMJ that really go through this in quite a bit of detail. But it's been very clear that the MMR does not cause autism, et cetera. And actually, Andrew Wakefield was stripped of his academic and clinical credentials, can no longer practice medicine in the UK. Unfortunately, he moved to Texas and resides there and has his own anti-vaccine institute there, where he is considered a martyr and is revered in certain circles. There have been multiple studies, and this came off of the CDC's website, but if you're interested in any of these articles, but over and over and over again, the measles vaccine has been shown definitively, unequivocally, there's no question about it, it does not cause autism. Unfortunately, the cat is out of the bag, and so, for instance, in 2011, there were over 30,000 cases of measles in Europe, France, Italy, Spain. The red dots, the size corresponds to the number of cases throughout. And in the United States as well, we had a resurgence of measles, primarily either people in religious communities or other places where there were a clustering of individuals who don't like to get the vaccine, and then importation from somewhere else, a case of measles that gets into a community that is not immune. So measles elimination was declared in 2000, And unfortunately, we started to see resurgences shortly after that. In 2014, we had more cases than we'd ever seen in decades, not since the mid-1990s did we see as many cases as we saw last year in 2014. And the reasons? Primarily, people who have philosophical or religious beliefs, and 80% of all people who don't get the vaccine fall into this category. Some people are ineligible as a result of HIV infection, leukemia, other immune function dysfunctions. Missed opportunities, others as well, but far and away the most important is this exemption here. Now, and then imported cases versus non-imported cases. You can see that domestic cases have gone up significantly in the last few years as well. Then along comes Disneyland in 2014, and there were visitors in the middle of December, so December the 15th through December the 20th, came down with measles. So we don't know who the patient zero was, but it was somebody who had visited Disneyland in the 13 to 14 days prior to the onset of illness in these kids. And then several Disney employees also became ill. It was strain B3, and that's identical to the strain that caused a big outbreak in the Philippines the previous year. Although other countries and other states have also seen that strain, so we don't know for sure. But statistically, that visitor is more likely to have come from the Philippines. And the Philippines, indeed, is another area that has a significant number of cases. So it spread from California throughout the state and then up into Washington, Oregon, and other places. 147 cases was the final tally. I think we're finally out of this outbreak as of a couple of weeks ago. But a significant number. I did talk to the state health department, and we did not actually see any cases of measles in this state, fortunately, as a result of this outbreak. And as of now, as of last week, there have been 162 total cases in 2015 alone. So maybe we won't be as high as this because there has been a big push to get back into vaccinations again. A lot of doctors' offices are not allowing kids to come into their office without being vaccinated. There are a lot of state efforts as well to try and mandate vaccinations. And that's the problem in the United States, but you can see the number of cases in other parts of the world, and you can see that Russia, China, the Philippines, Indonesia, and because so many people come to the United States from the Philippines, this is an area of big concern. We'll talk about this part of the world in just a moment. Remember, this is where Ebola happened just this past year. So what did happen in Western Africa? Well, as a result of the Ebola outbreak, the healthcare system really collapsed in Sierra Leone, Guinea, Liberia, and a lot of kids did not get vaccinated. As a result, and this just came out last month in Science, they're worried that there may be between 127 and 227,000 cases, new cases of measles after 18 months, resulting in up to 16,000 additional deaths as a result of not being able to give vaccinations. And so you can see what happens when a healthcare system collapses is that an awful lot of other vaccine-preventable diseases suddenly make a resurgence and cause problems. So this is one of many things that we're worried about once the Ebola outbreak finally subsides, and that's probably another talk for another time. So worst case scenario is we would start seeing big increases. If we didn't do anything different, the status quo would stay right about where it is now. But the concern is that this may recur with new cases and new deaths as a result. Could it get reestablished in the United States as well? And that's a big open question. In Vermont, Michigan, Idaho, and Oregon, 5% or more of kindergartners have non-medical exemptions to vaccinations, including the MMR. That's certainly enough to get you down below the threshold of immunity that I was mentioning before. Just this month, the California Education Committee voted 7-2 to eliminate vaccine exemptions based on religion or personal belief. In California, because it's been the leader in so many other endeavors, many other states are watching this vote. And if this happens in California, then a lot of other, and if their incidence of measles declines on the basis of eliminating the exemption, then that will be something that other states are going to have to pay attention to. Certainly that's the case in Mississippi, which is not a state that we think of as being a leader in healthcare, but they do not have a religious exemption or a philosophical exemption. And you cannot go to a public school if you haven't had your vaccines. And the Disney outbreak and other outbreaks have not happened in Mississippi. And so the cause and effect there, I think, is pretty obvious.
Has anybody sued them over it?
Has anybody sued?
Mississippi or? I would think that.
I imagine they probably have. I don't know the answer to that, but certainly the anti-vaccine group, they certainly have a lot of money behind their philosophical beliefs as well. But I can't answer that question for you. So this is an interesting quote from a PhD, the director of the Cleveland Center for Ethics, Humanities, and Spiritual Care. Have some parents forsaken parental responsibility in the pursuit of parental rights? This quote, do parents have any obligation to other children or just to their own biological children? I hope, certainly for our society, that we would be thinking collectively about what's good for all children and not just our own individual children. And, again, I know I'm sounding preachy, but, I'm an infectious disease doctor. And seeing anybody come down with measles is something that I just can't stand the concept that this person got infected as a result of somebody else who decided not to vaccinate and then exposed other kids to that situation. So there are a lot of very well-intentioned parents who want to do the right thing. And there are an awful lot of, unfortunately, people with a bully pulpit who are profiting on the basis of exploiting those kinds of concerns. And Bill Maher, the comedian, Mehmet Oz, Dr. Oz, is probably another one who's more egregious. But the one that I think has had some of the biggest impact is Dr. Bob. He's a pediatrician, the son of Dr. William and Martha Sears, and the parents have written about 40 books on all aspects of parenting, the Sears Parenting Library. His book was published in 2007 and made multiple misleading statements, stating categorically that vaccines have a high rate of side effects. They're not adequately tested for safety. The diseases they're trying to prevent themselves are not all that bad, that pharmaceutical companies misrepresent data, and he promotes an alternative vaccine schedule. The message in his book, doctors don't understand vaccines. We don't review the research ourselves. We never learn what goes into making vaccines or how their safety is studied. All we can say is that diseases are bad and shots are good. Public health agencies and pharmaceutical companies are not trustworthy. Claims that the CDC is in league with Merck and GSK deliberately misrepresented data about hepatitis B in order to push their vaccine. Vaccine mandates should be eliminated because parents who decline vaccination can actually have their children taken away from them. Vaccine-preventable diseases are not that bad. Too much too soon. The immune system of babies is not strong enough to tolerate all the vaccines that doctors want to give. All right. So, a few problems with some of the things that he said. It ignores the expert committees on vaccinations, the Advisory Committee on Immunization Practices, the Committee on Infectious Diseases. These people really do know a lot about vaccines, much more than Dr. Sears. And the members cannot have any ties to industry or hold significant amounts of stock in any of these industries. So they are independent, and you cannot be a member of ACIP if you have any significant ties to industry. These are experts in virology, bacteriology, statistics, epidemiology, and pathogenesis. He misreads the hepatitis B data, and he claims that only 360 children per year develop hepatitis B. Well, yeah, that's because of the vaccine. Before the vaccine, 16,000 children got infected every year. So he just completely misrepresents the reality, and hepatitis B vaccine is the reason they get the illness. And his claim that children who are not vaccinated can be removed from the home is just patently false. So who is he? Handsome guy, son of a famous doctor and nurse, visited in private practice. Does he have any special expertise in vaccines? Well, no. He's never reviewed a vaccine license application, never published a single paper on vaccines. He's never created or tested a monitoring vaccine. He has no expertise in any of these fields: virology, immunology, epidemiology, toxicology. So, you can come up with a couple different conclusions. Either he is a sadly misinformed, well-intentioned physician, or he is cynically exploiting the fears of parents, and he's made millions of dollars on this book. So, you can make your own decision. I've made mine. Sorry. The thing that bothers me the most is this alternate schedule. And he fails to recognize the most obvious thing. Babies start out sterile. In the womb, babies are not exposed to any virus, any infectious disease, etc. And during passage of the birth canal, they're exposed simultaneously to millions of new bacteria and proteins all at once. And this doesn't kill them. We have evolved to handle this. And so the idea that you're going to give somebody an antigenic overload by giving them a shot or two or three is just fatuous. And is it different to give an injection as opposed to respiratory exposure? The respiratory mucosa has miles and miles of blood vessels within the alveoli. And you're inhaling these things. You're also ingesting them into your gut. So it's just, it just fails the smell test, frankly. And this is what bothers me the most, is because parents are coming in asking for Dr. Sears' alternate schedule. And unfortunately, an awful lot of doctors are acquiescing to this. All right. And then I warn parents not to share their fears with their neighbors, because if too many people avoid the MMR, we'll probably see the diseases increase significantly. So hide in the herd, but don't tell anybody. Otherwise, disease outbreaks will ensue. So how much more cynical can you get from that? All right. So measles is a disease relatively new to mankind. Another example of a zoonosis making the species jump from animals to humans. It's among the most contagious diseases known to man. Systemic disease involving liver, spleen, respiratory epithelium, and a secondary site of infection. Disease results in profound immunosuppression, leading to multiple secondary complications, including death, as well as disability. The vaccine is very safe and very effective. Because it is so contagious, high vaccine coverage is necessary to provide herd immunity, potentially eradicable from the globe if we step up our vaccine efforts. And opting out of vaccines for any reason puts the entire community at risk, including those who cannot receive the vaccine. That's my last slide. So I hope I've stirred some controversy, and Anne's got her hand up first. Go ahead.
I don't disagree with anything you said, George, and I appreciate the summary of the Dr. Bob book. We had a discussion at General Club a few months back about distinguishing between hepatitis B and measles and rubella. In other words, the risk of hepatitis B is a really different thing. You can't get it from somebody else unless you have a needle exposure, parenteral exposure, or intrauterine. And so, to play the devil's advocate, when our kids were little, they did not have the massive number of vaccines that little kids have now. And so I'm a little sympathetic to the notion that we should, rather than just say everybody gets everything, period, that I think it was Eric X who said at the Journal Club, he actually said that the American Academy of Pediatricians have come up with their alternative schedule, which does allow the hepatitis B to be differentiated from the respiratory ones, the ones where herd immunity really matters. So that's my statement.
Yeah.
I would be interested in your reaction.
Yeah. So to summarize, Dr. Murphy is saying that hepatitis B vaccination might be different from respiratory disease vaccinations because it's not contagious in the same way that respiratory diseases are. And it's interesting to hear this from the pediatricians who may be very young, because when I was in my training, we used to only offer vaccination or actually screening of pregnant women if they fell into high-risk categories. And it turned out that we were missing thousands of pregnant women who did not fall into a high-risk category but had hepatitis B anyway. And those kids then did not get hepatitis B immune globulin, did not get started in the vaccination. And so it was that observation that stimulated the recommendation that hepatitis B be offered to all children despite socioeconomic or high-risk group designation. Hepatitis B is one of the largest killers in the world right now still, primarily because of places in Asia, et cetera, who have not been or who only are late to get the vaccine going. If you acquire hepatitis B early in life, you do not clear it in the same way that you do if you acquire hepatitis B as an adult. Adults, 98% of people who acquire hepatitis B as adults will clear the virus and become immune for life. As a child, if you catch hepatitis B, there's a significant chance that you'll carry the virus, shed the virus, and you're at high risk for cirrhosis and hepatocellular carcinoma. So it was those kinds of observations that adults behave very differently to the disease itself, and catching the disease early or preventing it early is, So I can't disagree more strongly with anybody's observation that we should try and not give one shot. And now Twinrix, hepatitis A and B in combination. Again, they're combining different proteins in order to limit the number of shots, just because it's uncomfortable to get 10 shots at once. But
I think the alternative recommendation is to screen all mothers for hepatitis B, and if they are negative, to allow the hepatitis B to be given at a later date. And so, I understand you're coming from the epidemiologic large population thing. I totally get that. But I also have a little sympathy with, if I'm a responsible parent, I'm really not going to be exposing, and I get the hepatitis B screen and I'm negative. Because as you well know, in the United States, hepatitis B is not very common compared to the rest of the world. So I don't know.
again, it's because of the vaccine that it's not nearly as common as it used to be. I don't know. Remember, it's also a sexually transmitted disease. So if you delay hepatitis B vaccination until adolescence, then you run the risk.
I don't think that's not the alternative recommendation. It's still
I think there's a practical issue. Every time there's a breach, you see you know there's going to be a problem with rates dropping. And it's the all or nothing type of approach that works. As soon as you start to make exemption for one, then buying up another, and even for this one, you can bet what's going to happen to George described. There's going to be hundreds of cases because people are not going to get screened, but yet they're still going to opt out. It's no longer mandatory. It's going to fall through the crack. And I think for a public health standpoint,
and the advantage of waiting, why delay hepatitis B? What
I've just heard from parents with little kids in recent years is it's the emotional, psychological burden of these kids getting massive numbers of shots. Now, and I agree I totally agree with everything that George is saying, but I do think the all or nothing approach. It's not entirely logical, is what I'm trying to say. And so people, there are the wing nuts who have all sorts of theories, including this guy and lots of mistakes, and they do make lots of money off of human suffering. But some of their concerns, like drug companies and public health agencies not being trustworthy, that doesn't come out of nowhere. There are legitimate concerns. Now, I think that we're stuck with this because of it, and I'm playing devil's advocate.
No, your comments are spot on, and everything. The pharmaceutical industry has been convicted of egregious practices,
and all I'm saying
as has the government.
If we stay preachy instead of accepting of logical people, where we know as an individual provider that person is going to get their kid immunized at age 4, not at age 14, but and we have systems now where we can follow that. Do I think that's the best way? No, I think your way is the best way. At the same time, I'd rather not alienate an individual in my office who is willing to work with me. And that was really Eric X's. Eric is totally on board with what you're saying.
Yeah, no, I appreciate that, but I think, as Dr. Tonnerre has indicated, the slippery slope is the issue. And the other thing that in terms of why people are not getting vaccinated is because of missed opportunities. Because once a kid is through his first couple of years, then they don't. I mean, my son didn't see a doctor for 15 years after he was done with all of his shots and everything else. He didn't get sick, so he never saw a doctor.
He had to in order to go into high school.
Well, I mean, I took care of a few things myself, but in terms of getting an HPV vaccine.
We still have these anyway.
Okay, we have other questions, so let's move on. Yeah.
I'm feeling very guilty because I didn't think you guys but I'm wondering, if measles is immunosuppressive, is the vaccine also?
The vaccine is if it is immunosuppressive at all, it's only very minimally so. Because again, the attenuation really speaks to that. Yeah.
I have a few questions. The first one should be pretty quick. The polio, you listed the R naught as anywhere from 2 to 15. What's with the wide variability?
Good question. I don't have a good answer for you. Why is the R naught for polio so different? That's probably another talk I should give at some point down the road. But it just has to do with the amount of viral particles that are shed, probably at different stages of disease. That's probably the best answer I can give you.
And then my second question is a little bit maybe more practical. If we're in our office and we have a child that we see the cough-like spots, there's some indicators that this may be measles. Other than obviously placing the child in isolation and contacting the health department, I mean, what things should we be doing? How should we be cleaning these rooms, or how long do they have to be left empty? And also, since these children die from secondary bacterial infection, is there any role for prophylactic antibiotics or anything like that?
Yeah, a whole series of really good questions about what to do if someone is identified as having or is likely to having measles. Well, the problem is doctors' offices don't have negative air pressure and all that, because ideally someone who goes into isolation goes into a tuberculosis isolation room with 15 air exchanges per hour, such that because remember that a disease that is droplet transmissible, aerosol transmissible, means that you can walk out of a room and somebody else can walk into the room and contract the disease, even though that contagious person is no longer in the room. So TB, smallpox, which is no longer an issue, measles, and chickenpox are the major ones that we have concerns about. So, that room probably needs to stay unoccupied for some period of time. The virus itself that's shed into the environment is very labile, and so wiping it down with anything you would wipe down a room with in terms of hospital disinfectants would certainly be adequate for that. Hand hygiene, vaccination of exposed contacts, notifying the county health department, notifying parents, etc., is the best we can do. None of us anymore have experience. We haven't had a case of measles in this community, I think, since I've been here. Anybody remember a case? Touch wood.
If the child is in school, by the time he has the cough and spots, he's infected, so you need to notify the school.
Absolutely,
Shut the
yes.
school down probably for a few days or something.
Well, I mean, that would fall then into the
Health department.
health department's purview, and that's probably what they would do, something along those lines.
And what about the issue of the antibiotics?
So, vitamin A has been given to people with measles to prevent some of the complications, especially blindness. Hopefully these kids have received pneumococcal vaccination, and that's one of the major ones. Prophylactic antibiotics, the problem with that is that they cause diarrhea very often as well. So I think that watchful observation is probably more appropriate. Not being a pediatrician. Yes.
On your slide about herd immunities. You listed TB, but there's a question mark out of how do you get herd immunity these days for tuberculosis?
Yeah, we, there is, you don't get immune to tuberculosis. I mean, if you're exposed to TB, you probably are less likely to develop active disease because of your own immune response, especially if you don't take isoniazid for 9 months. Yeah, there's no vaccine that's really effective, and BCG is not really effective in preventing cavitary disease. So, yeah, that's why the question mark. Okay, good questions. Thanks all.